Good afternoon, everyone. My name is Nwagaba Isabella, a student at Mbara University of Science and Technology, pursuing my bachelor's degree in Information and Technology. So I'm here to present you my hospital patients records management system that I was like a problem statement that I was working on. So without wasting time, as you know, like the problem statement, as you know, I had already made the introduction. As you know, like the problem statement, like what I was trying to solve. Hospitals and healthcare facilities handle a vast amount of patients' data, including personal information, medical histories, appointments. In many cases, this data is managed through paper-based records or multiple disconnected, leading to the like inefficiencies or data duplication errors what. So I decided to come up with a database system. So one of the objectives of this system as one of the objectives, one of them is the centralized patients records. There are many, but I tried to put them in, outline them. So these centralized patients records, this one helps to design and implement a centralized data system that securely stores and manages all the patient's information, including the personal details, medical history, stuff like that. Then here another one is the improved data access. Here, the improved data access helps to provide the healthcare providers like the doctors, nurses with quick, easy access to patients' data, improving decision making and reducing the wait times during the patient's care. Another one is the enhance the appointment scheduling. Here, the appointment scheduling, it helps to create an integrated appointment scheduling system that allows for real-time booking, cancellations, like ensuring the efficient patient flow and minimizing the scheduling. Then another one is streamlined billing and payments. Here I'm trying to explain the objectives. This streamlined billing helps to automate the generation of the patient's bills and support the tracking of the payments, like if some patients that have not paid and some that have paid. Then another thing is to ensure the data security. Here, ensuring the data security, I mean like to implement the robust security measures, including the user authentication, role-based. Yeah, so that's how I can explain the objectives. Are many, but I try to outline the few of these. So like the possible data systems, I tried to find out, like I outlined some. So these are the ones that I tried to find out. One of them is the electronic medical record system. These are the possible data systems that relate to my database. The patient's record, healthcare, cloud-based document, and so on. So among these, were told to choose among the best. So the best I could choose was the electronic medical record system. And this, the reason for choosing this, reasons for choosing this EPIC. One of them is the comprehensive patients management. Here they comprehend, like provides a robust platform that covers all the aspects of the patient's management, including scheduling, clinical reports. Then here the interoperability for it helps to facilitate data sharing across the different health cares. Then it is a user-friendly interface. The system is known for intuitive user interface, which helps enhance the user experience for healthcare. Then the strong analytics. Here the EPIC includes advanced tools that allow the organization to drive insights from the patient's data. So those are one of the reasons that I would give for choosing the EPIC. So the developing a business case development. A business case development includes, it has things like the application domain, the supported tasks, the user groups, the healthcare, stuff like that. Yeah, then the user groups can include the healthcare professionals. Those are doctors and nurses. Those are that are always taking care of the patients and stuff. Then there is the patients themselves. Then the administrative staff. The administrative staff can include the finance managers, the accountants. Yeah. Then benefits of the analysis. One of the benefits is the improved efficiency in the patient data management system. So like these ones, there are many. the benefits of the analysis. One of them, there are a few here, but there are many. I just try to outline them. So the intangible benefits are the enhanced patient satisfaction. Then the cost analysis. The cost analysis here, there are tangible costs, database software licensing, then the hardware costs, the training costs, the training expenses where you're training patients or some doctors or some of the new members that need to adhere to the patient's things or the hospital. Then here the intangible cost, time spent on training, then the potential disruption during the transition. Yeah. Then the risk assessment. One of them is the technical risk assessments. There are many technical risk assessments, but I tried to outline them. One of them is the data migration issues from the legacy systems to the new database. Then another one, maybe if I can add, there is potential security vulnerabilities during the implementation, like when you're implementing. Then the organization risks, here I tried to outline like one of them, resistance to change from the staff accustomed to the existing processes. Then another one is the inadequate training leading to improper usage of the system, like here, yeah, on the organization risks. Yeah, then you can put like other risks, be like the compliance with the regulatory requirements. Yeah, things like that. Then after a risk assessment, then the limitations. Of course, everything always has an advantage and a disadvantage. So one of the disadvantages or the limitations, one of them is the data privacy concerns, that despite the security measures, despite of how like you be securing your database, there will always be those limitations that limit the data. One of them is the data privacy concerns. Despite the robust security, there are always risks. Then there is dependency on the technology. You're always depending on the technology, such as using of computers, everything. So you find like when there is no electricity, it will disturb the work of the doctors or the nurses to do their work. Then another one is scalability issues, like extreme growth may require a migration to a more robust system. So in conclusion, summary of the project success in developing a core health patients records management. I decided to develop that to help ease the work of the doctors in hospitals, but when they are recording the patients' records. Thank you for watching. My name is Mwagawa Isabella. Subscribe, share, and link, and thank you for watching. I stay Mwagawa Isabella, student at Bara University of Science and Technology.